Good morning and welcome to the January edition of the CE's weekly media briefing. I'm giving everybody permission to record and then we'll get started.
Recording in progress.
Reporters, you should now all have permission to record. If you do not, please let me know in the chat. And with that, Lorna, we'll get started in 5, 4, 3, 2, 1. Over to you.
Good morning, everybody. Welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Marc Elrich. I'm Lorna Vigili, Hispanic Public Information Officer, and joining us today is Dr. Earl Stoddard, who is Assistant Chief Administrative Officer, as well as a special guest, Director Anita Vassallo from the Montgomery County Public Libraries. Reporters, all of you should already have permission to record. If you do not, use the chat, as well as use the chat and identify the organization you represent once we get ready for the Q&A portion of this presentation. The county executive needs to move on to another event at 12:25 p.m. Our other two guests can remain in case we need to. And with that, let's get started. Mr. County Executive, good morning. How are you?
I'm fine, mostly. If you hear me clearing my throat every once in a while, it is the continuing lingering effect of my 13-week interaction with COVID. So this is still here. I want to thank you for joining me today for our briefing. I'm talking to you today from the Potomac Community Center. Immediately following this briefing, I'm going down the street to the Islamic Community Center of Potomac for a funeral service for Tufail Hamad. Tufail was a real pillar in our community and a major presence in the Muslim community. I knew him for more than 20 years, and he was a tireless leader for justice and as honest, gentle, and compassionate a human being that I ever had the honor to work with. He saw all of us as part of the human family. He worked tirelessly for everyone in Montgomery County, and he never grew weary of striving to do more and better. He was not shy about talking about the needs in the community and advocating for the community. He always saw the whole picture, and he always understood that we were all bound together in doing this work. I'm going to miss him as a friend and partner and in the work to build a more just and understanding society. And Montgomery County is going to miss him as someone who always strove to be the best person that he can be. And my condolences to his family and to all of his friends. We are going to miss him, and I just wanted to start with that. Back to COVID. This week, we're seeing reductions in both our test positivity and case rates. Our positivity today was almost 17%, which is about a 10% reduction from our peak in the surge, which was 27% on January 5th. Our current case rate is 1,193 per 100,000 residents. This is a 44% drop from a recent high of 2137 on January 9th. And although these numbers are going in the right direction, they're still among the highest rates we've seen throughout the pandemic and over 8 times higher than they were at the beginning of the month. So getting lower numbers is a good thing, but the numbers themselves are not good things yet. They're just a sign that we're moving in the right direction. The bottom line is we still have a long way to go to get back to where we were just a very short time ago. We're also seeing our numbers drop slightly in our hospital bed utilization rate by patients with COVID. This is the lowest number we've seen in 2 weeks, and it's welcome news for our hospitals and our frontline healthcare workers. That said, our hospital utilization rate is 6 times higher than it was at the beginning of last month. One data point that we see that is still increasing is our COVID deaths per day. Due to the county's high vaccination rate, you can see we're still significantly fewer deaths than the state average. Montgomery County represents 17% of the state population. We're only showing about 8% of the deaths from COVID this month. On that data point, the data point that matters most, this shows how important it is to be vaccinated and boosted. There is a significant difference in outcomes for people who've been vaccinated and boosted, and we continue to see that in cases and the severity of cases. Regarding schools, we continue to see disruptions from the surge in cases in the school. Yesterday, MCPS announced that 16 more schools would be moving to virtual learning starting tomorrow until January 31st. I support these decisions made by MCPS, and they're in the best interest of the health and welfare of the students, staff, and families. I want to make a few points. We all wish this were more predictable and easier to manage, but it's not. Omicron proved to be dramatically different than Delta, so everyone has had to change their approach. I know that for the school system and for a lot of what we did, our assumptions and plans back in the fall of 2021 were based on the Delta variant. Those assumptions and plans do not match Omicron. And so all of us have to change our approach to dealing with the virus because it's really a different virus that we're dealing with now. Same name, very different mode of operation, very different level of infectiousness. I know that this is extraordinarily difficult for everyone in the schools, staff, students, teachers, and families. It is disruptive and it's exhausting for teachers and other staff who are filling in for those who are out. Teachers are giving up planning time and lunchtime to fill in, and parents are stressed too. Many are concerned even more than they were in the fall. In the fall, when we were dealing with Delta, which was much less infectious. Other parents are concerned about learning loss, which is a concern for all of us. As changes are made, the important thing is to constantly and consistently monitor what's happening and respond to changes in a timely manner. Clear metrics are needed and they need to be applied in the timely manner so parents, staff, and students have some sense of how decisions are made and what to expect. And some of those metrics have to deal with the operational shortages. Omicron has created big shortages of bus drivers, teachers, paraeducators, and other staff. And that makes it extraordinarily difficult in some cases to maintain learning. The school system is not, isolated in these staff shortages. The county government is suffering from staff shortages as well. So this is the nature of work, whether it's in the school or in the county government or the private sector right now. Omicron is messing with staffing levels and creating problems. We're going to continue to work with MCPS to help them acquire more rapid tests. We've already provided about 240,000 tests to MCPS and are working with them regarding the contact tracing following their request yesterday. As a government, we have our own limitations and staffing challenges, but we're going to do what we can to ensure both the health and education of our children. One place where we can find some comfort is that the particular surge is temporary. When it will end is unclear, but I don't think we're talking about months. We're talking about weeks to get us out of the worst of it, assuming the virus doesn't have any more unpleasant surprises for us. Around the world, it looks like the virus ramps up and then ramps down on about the same pace. And if that's the case, that would put us maybe a month away from ramping down to a more reasonable place, but hopefully we're moving in that direction. 2 weeks ago, I said that we were going to have a three-step approach to combating the surge in the county. We can see from our numbers this week, this approach is helping, but we have to remain committed to this plan until we bring these numbers back down. The first step was ensuring our residents had access to testing. So far, out of the 2.1 million rapid tests that we've ordered, we've distributed 792,000, given 240,000 to MCPS and an additional 60,000 are going to childcare providers this week. We've given out over 303,000 tests directly to our residents at our county libraries in just over a week and a half. These are incredible numbers. In the first week since the launch of the portal to report tests, we've had over 900 residents report their test results. We want to encourage residents to please let us know when you're positive, but also let us know when you're negative if we're trying to figure out how many cases are popping up versus the number of people who are being tested. Only getting the positive numbers is not as useful as getting both numbers. It helps us to better understand and identify where the virus is spreading in our community. I'm also pleased that the federal government is mailing out free at-home COVID tests now. And I encourage all Montgomery County residents to order these tests at https://www.covidtests.gov/. Although we have ordered a lot of tests and are still waiting for 60% of our shipments to arrive, we continue to discourage hoarding of rapid tests so everyone can access them. Utilizing all opportunities such as this offer from the federal government so that every at-home test or everyone at home can have these tests on hand. I just want to mention that one further challenge has been the government is asking suppliers, at least the one we're using, to prioritize meeting the federal government's demand for test kits. And of course, our concern is that will interfere with the supply of test kits that we're being given. But on the right side, everybody's going to be able to order test kits from the federal government. Our vaccination rate and boosting, the second step we wanted to do is double down on our efforts to get residents vaccinated and boosting. You can see from from this chart, we've given out first doses to 1,050,929 people. Fully vaccinated are 893,000 people, which is 85% now. And the booster, though, is only in the arms of 416,000 people, which is about 46%, 47% of people who could get the booster. And I want to emphasize this again. I said it last week. The booster matters. We know that the efficacy of the vaccine wanes. We know that if you're counting on natural immunity, that also wanes as well. There's clinical evidence now that the boosters restore the protectivity that was associated with the first two shots of the vaccine. So it's important, if you want to continue to stay healthy, to get those boosters. So please take advantage of them. We've got the booster shots in the county. You can mix and match. We're ready to give you the shot. Please come in and get your shot. The third step that Montgomery County was using was mitigating community spread. And I believe our proof of vaccine legislation will be helpful, and I'm glad the council is holding hearings and getting community feedback on this legislation. I listened to some of the concerns and criticisms raised, and I expected that sort of feedback. However, I don't accept the premise that implementing this legislation won't help us reduce our transmission rates. I especially want to call out people who are talking histrionically about shutting down businesses. This thing only really applies to restaurants, movie theaters, and gyms. We're not shutting down businesses. We're doing this to control the spread so we don't have to shut down businesses. And these businesses aren't being shut down. The goal of the bill is just to require the people who come into the businesses are already vaccinated to help minimize the spread among the rest of the population. That's it. No closures, no shutdowns, none of that stuff. And in the county, where 90%, 95% of our people are vaccinated and 85% are fully vaccinated, no one's going to be losing any customers. So DC's doing it. We need to do it. This is a temporary measure, but it's one of the things I think we need to do to help mitigate the spread of COVID here. DC began implementing their proof of vaccination last weekend with little issues or disturbances. This is going to be a tough vote for our council, but I do hope they follow the lead of the district and help us get through the surge. I've actually, gone to places that require proof of vaccination. We're not requiring some kind of special passport. And every time it's been as simple as walking in and either somebody at the register or somebody who's seating you says, can you show me your proof of vaccination and your driver's license? And they're asking, so everybody has it ready. You show them the proof of vaccination and driver's license. That's it. No long lines, no massive delay, no nothing. So this is minor and hardly a major setback to the normalcy of our lives. So again, I hope that the council acts on this. Another key element that's helped us reduce community transmission is the wearing of face masks and face coverings. We know that masks work. Today, I'm happy to announce that starting Friday, we'll be giving away N95 masks at our libraries during rapid test distribution hours. So if you're interested in getting an N95 mask, which is recommended by the CDC, having these higher quality face masks as compared to simple face coverings will increase the amount of protection you get. Montgomery County residents can pick up the free N95 masks at 19 county branch libraries beginning Friday, January 21st. Last Friday, CDC updated the mask guidance to emphasize protection to prevent the spread of COVID-19. N95, KN95, and KF94 respirator masks are masks that have been shown to provide higher levels of protection against COVID. And residents can pick up 4 ZYB-11 masks, which is a brand of N95 mask, per person at any one of our 19 libraries beginning the 21st. Supplies are limited, and the masks will be available on a first-come, first-served basis. Today, I'm pleased to be joined by our library director, Anita Vassallo. I want Anita to share with you her thoughts and perspectives on our rapid test distribution, as well as talk about the logistics of how we'll be handling this. Two other things I want to add before I close. One is I want to thank all of the county staff who've helped us with storm cleanup, and apparently you're going to get some more practice at storm cleanup, possibly over the coming week, maybe twice. They did a really good job, and I want everybody to remember they're working with staff shortages as well. They did a good job getting the roads and keeping the roads clear. And I just want to thank them for that, because it's hard work, and it's hard work when people are being asked to do more work with fewer people. And I want to also note that there was a bill introduced into the General Assembly today in Maryland that would make it a crime to threaten public health officials. Our public health officials have really been subjected to a lot of scary threats and abuse, and this should not be tolerated. You know, any of us who saw the kind of emails that Dr. Gales was getting when he was here, all of us were shocked. I mean, the language, the coarseness, the viciousness of the kind of attacks he had to put up with, nobody should have to put up with, let alone somebody who's trying to save your life. So I'm glad this legislation is being introduced. I only wish it were retroactive, but it's important to get this on the record and protect health officials. They're here to serve us. They do this work because they're experts in the field of health, and their goal is to keep us all safe. They deserve our respect. We may have differences of opinion. Some of those differences are less informed than others. But whatever the case, threatening a human being, threatening a doctor or a public health official is just absolutely unacceptable. So I'm going to stop there, and I'm going to turn this over to Anita for some brief remarks, and then we'll hear from Dr. Stoddard. Thank you.
Well, thank you very much for the intro, County Executive. I'm very pleased to be able to be here to talk about what libraries are doing with the test kit distribution, along with Dr. Stoddard. So on Monday, January 1st, Dr. Stoddard met with library administration to first broach the idea of having library locations provide the rapid test kit distribution. And a week later, on January 10th, we were doing it. It was an amazing amount of pulling together by so many departments of county government, both libraries, the Department of General Services, Health and Human Services, the Office of Emergency Management and Homeland Security, Technology and Enterprise Business Solutions, just a whole raft of people who pulled this together in order to be able, on the first day of our distribution, to distribute over 90,000 test kits to community residents. So my thanks goes to all of those folks. And then, of course, to the staff that's been working with the test kit distributions. At most of the libraries, we are doing this either in a meeting room that has an external entrance or just within the vestibule area. So although people may have seen large lines and a lot of traffic issues the first week, it really wasn't impacting inside the library in terms of regular library business. Our library staff who are passing out the test kits are volunteers. We have had support with volunteers from HHS, from OEMHS, and also from the Medical Reserve Corps, which is a great group of medical professionals who are donating their time in the response to COVID, I believe across the country, but certainly here in the Washington area. So a lot of people to help, the management teams at each of the branch libraries who are helping with the logistics of getting the boxes of kits to the volunteers to hand out. At library administrative staff who helped pull together so much, including our real-time test distribution list, which you can find on our website that to check to see if library is out of tests. Today was the beginning of the second week, and we did notice that the demand, or yesterday, had gone down a bit. This may be because of the announcement, of course, by the federal government that they'll now be mailing 4 test kits out to each address. As the CE mentioned, this coming Friday, we will begin providing 4 N95 masks to each adult who comes to our test kit distribution. The masks will be available during the test kit distribution. Those hours are available from the library's website. So we have 9 libraries providing test kits in the morning hours from 12 to 2, early afternoon, and then 10 libraries providing the test kits in the late afternoon and evening so that people have a variety of times when they can stop by. Our community has been very, very appreciative. We have received many comments from people thanking us so much for participating in the test kit distribution. I know that you've probably seen video or pictures of long, long lines. It can look daunting, but they move very, very rapidly. I participated in the test kit distribution on the first day at the White Oak Library, also Marilyn Praisner and Germantown. Very efficient. People are in and out within a minute in terms of picking up the kits and being ready to go. So that's how it is working for us here in Montgomery County. And I think libraries are a great place to provide this service to the community. We have 19 locations around the county. Libraries are a trusted institution to many of our residents who don't feel comfortable in more official government facilities. And we are very, very glad to be helping with this. Thank you.
All right. I just have a few additional opening comments. I first want to talk about, I know that there's an ongoing education and culture meeting with the county council right now with many of our HHS partners as well as MCPS partners discussing, how that partnership works and how MCPS is responding to COVID and sort of some of the additional items. They did make, before the Board of Health yesterday, 2 additional requests for support from the Department of Health and Human Services. As I believe Dr. Kroll just made clear to the council, we received those requests on that briefing. Did not get them ahead of time, so obviously we had to react to them. We met yesterday afternoon. The 2 requests, as a reminder, were MCPS wanted to get out of the contact tracing business, as they described it. And they also wanted, I believe, 190,000 rapid tests provided to them every other week, which is about 95,000 kits a week. So I'll talk about them in that order. So contact tracing, obviously what's happening in MCPS is not actually traditional contact tracing, it's contact identification. And that is where you identify the close contacts of a known COVID case so you can determine who needs to quarantine and who doesn't. So you can provide that information to parents and families when their child is being, obviously sent home as part of a quarantine or notified that they can't attend the next day. Typically, that process looks like teachers and identifying who was proximal to a known case in a classroom. They provide that to the central office, and often the central office is making the calls to parents to determine vaccination status, to determine whether the person actually needs to quarantine or not. So we will be providing them some additional support, but I want to make some things clear in the sense that MCPS cannot be uninvolved in this process. The first line of contact identification is simply identifying who was proximal to a student in the classroom. That information lies with the teacher in the classroom and the teachers throughout the building who may have had the index case in their classroom. And so there's no situation, there's no jurisdiction in the state, certainly, there's no jurisdiction that I'm aware of regionally or nationally where the local health agency is exclusively doing all parts of the contact identification process. The schools have to be involved, they have the information. We will be providing them additional support to support that, to alleviate some of the eliminate some of the backlog or work that they have to do on that contact notification and interface process, but they will still have to be involved in that front end process. There's no way around that. On the rapid test distribution, obviously, as Director Vassallo alluded to, we've been making test kits available throughout the community. We have seen a significant slowdown in deliveries of our rapid test kits. We were informed by the vendor that we've been working with, same vendor that DC is working with, that the Department of Defense just placed a 200 million kit order that they demanded 10% of those kits up front, which is 20 million test kits. We have seen a dramatic slowdown as a result of that in our deliveries. We were expecting a delivery to be shipped on January 14th and January 15th. I know I remember talking to members of the media about that. That shipment still has not arrived. We were informed this morning that there was a delay, that they're actually sending it out today, which means that we have essentially 0 test kits in our warehouse for the remainder of the week. We have pre-positioned test kits at our libraries, but that means there are going to be no additional kits available for any other provider at this point until that shipment does arrive. We have a number of community centers or community partners who have reached out to us. We have MCPS, we have private schools, we have of opportunities aimed at our disability. Obviously, we want to service all of those left in a significant bind. 140,000 kits that are provided to MCPS test kits, but we are also looking are distributed because families like mine order and acquire test kits to provide my family test kits. We burden without it, so we want them obviously to do not have as ready access to. We will continue to provide them support, but we want to make sure that of their need with test kits availability at this time. So, questions?
Thank you, Director Vassallo. Questions on the chat from members of the meeting. All righty, Darcy Spencer. Question. Good morning. Actually, good afternoon. Darcy?
I don't do a whole lot of these, so a little bit of on as far as the mass distribution, the count is how many you have to just. I wanted to ask the county executive something.
We have about the state of Maryland. The governor did announce that he was going to make masks available to local health departments to distribute. We haven't, to my knowledge, we haven't received those masks. That Montgomery County had acquired 4 million of the mask type that the county goes to the public. So approximately 4.
And that cannot.
Correct. They're only adult sized. Allotment from the state includes all we have are the adult size.
Okay. We have received some community activists regarding ability board, and they want some changes to that. The things they're saying that it fails to reflect the inclusion and things like that. And as I understand, you want activist groups are not happy. Could you give your response to that?
Yeah. To explain some of this, but I'll just say I'm not happy with some of the implementation guidance that's coming from the state and maybe coming from the state. The goal of the group, and Dr. Starter can talk more about it, is when they wrote this was to write a framework based on the legislation, knowing that it was going to get modified. I mean, there are changes I want to make, but we weren't going to make changes without a public process. And so we're anxious for this to go in front of the public and make changes. I probably agree with most of what other people want to change, but I want Dr. Starr to make clear where this thing came from, because people keep referring it to as my legislation and my bill. And this is like seriously wrong.
Yeah, I want to explain a little bit about this process. So in the county, we have what's known as our Reimagining Public Safety Implementation Committee. Executive branch, but also members of the county council staff, specifically Mr. Bob Drummer and Miss Susan Farag. There are a number of members from the executive branch, myself included. I actually co-chair it with Assistant Chief Darren Frank. Back in October, we obviously as a group were focused on the October 1st implementation requirements of the Police Accountability Act. Those included the Public Information Act changes and a few other changes that need to be made. After those changes were implemented by October 1st as required, we transitioned over to looking at the Police Accountability Board and the administrative charging committees as work that we needed to accomplish. When we looked at the timeline of that process, we knew that this was going to be extremely tight in the sense that in order to meet the July 1st requirement, we had to have a Police Accountability Board legislation enacted. We had to have a board nominated and confirmed. We had to have staff hired for the Police Accountability Board to staff it and allow it to function. We had to have a request process for them, or not a request process, a complaint process for them to be able to receive complaints. And because the Police Accountability Board actually names several members of the Administrative Charging Committee, they need to be able to name those members, have them be confirmed and trained, and then those members develop their own internal processes for the Administrative Charging Committee to operate. Given those timelines and the uncertainty that the county executive alluded to, we know that the Maryland Police Standards and Training Commission is developing regulations pursuant to how PABs and ACCs operate and are with the requirements, including membership of those committees. Those have not been released yet. So we know functionally that there is more information that's going to come from the state that we have to act on. And so what we did is we developed a draft regulation or draft council bill for a vehicle to allow for a public conversation to happen, even while we recognize that the ground that we were building under was made of sand, because the state is going to enact more regulations that influence what we can and can't do. So this Mr. Drummer from County Council, as a not at the behest necessarily of a member participant, he took and volunteered himself bill. We modified the original committee. The committee met at the end. Council members do you want me to find, or do you want it to come from the county executive? I said, hey, we wanted this to be a collaborative process. Executive propose it to the council so we can show this as a has been utilized to undermine the county executive. Regulation was meant to be the final product because there's so much that is changing. But I'll partnering with council staff to get this process and meet the timeline that's been laid out. Background on this. We knew from the beginning submitting it on behalf of the county council did not to suggest changes. We knew we had submitted because it had been a lack of knowledge about what is draft ACC regulations that will directly in our community want to be, in fact, limit what some of the membership who can be qualified or not. Things that we don't necessarily support of in the background being out there. There's a lot of background there, but I just think it's totally back to the county executive because it was developed to council staff and executive branch staff done as a reflection that this was going to be a there's a lot of community feedback that needs to go into the process to allow that lengthy If we had done a lengthy feedback process in the beginning, obviated the council from doing that well, and we would not have had the legislation in. Done both of those things. We alternate process is effectively have a process in place by July 1st. That's something we chose to do. And so I just want to we recognize there's a whole lot meeting with advocates this week to discuss those things. Endpoint bill. This was simply a vehicle.
I'll just add one other. Mr. Drummer, council members. So there's like, what bill? How did this? Actually, they were. Political is not a way to do business. Ownership was something that they were. I think there are plenty of reasons, as Dr. And it needs to go through a public hearing. Everybody was engaged in this, and so I'm kind of to some members that this is somehow shocking.
Thank you, Mr. Council. Steve Bonnell, but that's the beat.
Afternoon. I just want to clarify masks that are going to be given out starting Friday, and on how long you've had these.
During the surge of the pandemic, so we actually created if we ran out from fire rescue, ran out of N95s, we were going to be the back. And so at earlier phase in the pandemic, the system collapsed as it did at various backstop all of those organizations that we knew didn't have those protections. Recognized, and as CDC made their change, these masks, they seem to be more readily available. So now we feel that we can comfortably and burn through our stockpile. A limit should the hospital in theirs, but because we always felt we had some level in reserve so that we could system in Montgomery County infrastructure fail them again.
This might be, a week or two. Test kits, though, in terms of the timing. Starting the test kits at libraries.
Make sure that we have the logistics in place to do the test kit, and obviously adding on, more logistics to move than the test kits are. That could actually operationally execute this. The libraries were necessarily going to be so I'm so how fast we were going to be operating. We will operate a lot faster. When we saw that how efficient it was as a distribution public, then we said, let's just add in had a system that could operate well in doing those.
Even if you get these 4 million out, like how many do you left, I guess?
At the end of this, after we distribute these four, but there are, we got a variety of different. We're using all of one type, which is our most. The other masks that we do have, we have our fit tested employees on them, meaning corrections officers have been fit tested large. And so we're holding back in reserve those on, and then also our hospital million at the end of this that we can utilize.
Yes, but the rapid test kit situation, DC on the shipment, do you have any contingencies if they don't today, but
No, I mean, it's frustrating for us. I mean, we fought tooth out into the public than any other jurisdiction around us. So they started earlier, but obviously we've been shipped out of our warehouse, meaning they're in libraries, childcare centers, etc. Obviously, it's frustrating to run it, but then obviously it's frustrating to just shipment that we were originally promised of this pandemic, where we don't have everyone sees that you found that part and that partner dries up, and so that's centralized, fractured.
all right, thank you.
Ryan, WTOP. Good afternoon, Kate.
Appreciate it. And forgive me if this has been asked. Education Committee hearing. On the test kits, rather. Test kits are our school system. I know they wanted 102 weeks. Is that right? And again, as you suggested, is this the really good source we had that made these, or is there something else at play? And
Part, but I'll try and give. Need to provide rapid tests to MCPS. What the right size of the amount is, because I know many parents, myself included, rapid test kits at this point. We've been able to successfully order them. There are families that have not been able to. And we want to make sure that those parents do have that need within MCPS to provide to them. Distribution, we're focused with community groups, we're providing a number of different avenues for test kits available. MCPS should be testing every student as a mechanism in school, not coming in at the quantity we need. So we will about that, but we're going to make sure that we're going to write based on the actual need that we will be providing. Now, as I do not have anything in our website until we receive our next delivery, there will not be any to have got clinic schedule or distributions to our allocations for those until we receive functionally given out everything that we've received, and is going to force us to. Yeah.
Have they given you an ETA on?
That they were shipping out on the 14th or 15th, and when they didn't ship out until today, Friday or Saturday, given they're coming from 2-hour timeline. So my guess is we will make an allocation to MCPS. We will make an our community partners.
Tracing in schools. In the education discussion, Sean O'Donnell, that right now there are 20 DHS staff in the schools, but he made this even with those that contact tracing in the schools, they can't. Why is that? Couldn't they just do this? You teachers and staff, can you tell us what the complications are here?
So I think that's the point that he was trying to raise. So the person, when you think about a classroom experience, right? You have a student in a classroom who ends up testing positive with COVID. When they are trying to assess who are the close contacts, really what schools are doing is not traditional contact tracing, meaning they are trying to rapidly identify close contacts to provide them information about whether they need to quarantine or not. They're not doing the contact tracing of figuring out where the student who is actually an index case was exposed and try to backtrack all that. That's what traditional contact tracing really is. They're doing contact identification to a specific a case in the classroom. And so the person who has the information about who was proximal to the index case in a classroom is the teacher. And that's the point that Mark was trying to Mr. Hodge, sorry, no, I know him very well. So I know this is what he's trying to break. CPS is uninvolved in this process. Have the information about Jane or Jimmy or whomever in the classroom and can say, these are the 4, 5, 6, 7 students who were close. Now, where we can assist is once those teachers identify those number of contacts is contacting families and parents and making them aware of the exposure and identifying vaccination status, because if they're vaccinated, they don't actually have to quarantine. The teachers are also involved in are the exposed students, were they effectively wearing masks at the time of the exposure? That's the information the teacher would have. And so they can say, okay, yes, they were, we don't have to quarantine those students. And so we can support them in this effort, but there is no jurisdiction in the state of Maryland or anywhere that I'm aware of where the teachers and faculty of a school are not involved at all in the contact identification process, because they have the information about the potential exposure points. We can help them in the back end process of calling parents and finding out the back end information, which is what we're offering here. There is no divorcing them from a role. And so it's going to take some level of time for MCPS to participate in this. Furthermore, the traditional multi-day process, that does, if you look at the Maryland Department of Health's data, it's public, they were contacting 17 within 24 hours. That tells you tracing as an apparatus is what's happening in Montgomery County as well. And it's only getting to 20 who need to be contacted traced. And so obviously their contact identification, contact tracing, it requires immediate, now less in-depth analysis, which is what traditional. I wanted to bring that up because what they're actually contact tracing, it's contact. And so we are going, there are 209 schools involved in that process because they have to make it easier and lessen the burden, because we agree that they're not going to be totally removed from this process.
Follow up on the test kits. How many in transit right now? Do you know how many you're going to receive from CPS?
It's 196,000. It's, they break it down by pallets, so it's 100. And, 50 or so thousand to MCPS, but I won't. As I said, we'll talk to them. If it ends up, it'll be a conversation with them to figure out what is them and how they're distributing them and who they're. It likely won't be the full 95,000, more or less half of what we're receiving. Sure that we're serving other vulnerable partners. Some of our etc. So, we will to support MCPS further, and we'll have to. The partners have access to the resource as well.
Thank you, Kate. Next up, good afternoon.
Janae Dill with Axios. Question, sort of, now that we're coming down, what's the approach to dealing with the pandemic moving forward? I mean, I think everyone would have liked to have distribution and Is this going to stay? Or is it going to be ubiquitous going forward?
Yeah, it's certainly our intent to not operate. Obviously, we will I mean, I think it's reasonable to relax restrictions when cases are where we would be, and I think county executive alluded to, is it would be a short-term is for when cases are surging. They roll back as we see Omicron, lesser. There could be another variant of. We stock our supplies and resources between these variants. Now, I don't know when or we could not be. So we obviously will quickly move to sort of restock and resupply and make sure that we have an on-hand capability to respond more rapidly than we did with the Omicron variant, because I think just because we're finished with the pandemic doesn't mean the pandemic's finished with us.
Yeah, I just want to add quickly that, one reason we've got like the masks to give out is we made a decision to supply ourselves for the future, because we anticipated that Omicron, or we were anticipated that COVID wasn't going to be done with us after the first visit, as it proved to be true. Stockpiling tests may be more problematic because, like we know with these tests, some of the reports say these tests are less sensitive to Omicron than they were to earlier versions of the virus. So I don't want to stockpile enough tests for 1 million people only to discover that the next variant has figured out a way not to be detected by it. So I think there's a balance that we have to have in terms of knowing, that the most effective equipment is what's going to be available, and that we can have an appropriate supply of it going forward. But we understand the need of trying to get ahead of this curve, and we are going to try to stay ahead as much as we can.
Thank you, Mr. County Executive. We do know that you have to head out to attend that
Yep.
funeral. Thank you for joining us today. Thank you, Kenneth. I think we do have a couple more questions from Scott Broom, WUSA 9. Good afternoon, Scott.
Hi, everybody. Earl, we really appreciate the detail you just got into in Kate's questions. I'm hung up on testing too in the school system as well, because they handed out, I think it's more than 300,000 kits. I've been unable to get any. How many parents reported into the county, what the results were, sort of what a result rate, reporting rate would have been, and what the result board shows. Now 9,000 active total students quarantine, and then I'm just really struggling to find what this testing protocol in schools has produced. Have they shared any data with you, which helps us understand what's going on? Have they shared any data with you from what this first round of testing they did produced?
So I'm not privy to the data they provide to us. So I honestly didn't ask. So we could certainly follow up, but I don't know. I don't want to say that they haven't provided us or that they have provided us. I don't know. So I certainly follow up, but I'm not aware of. I haven't been provided results, so I don't know.
Well, I mean, what I'm getting at is, we're in a situation, and it was predicted last week, that additional schools were going to go to virtual learning. They provided us a list of the metrics they make that decision on, but they haven't told us what the metrics are. The actual numbers. In the briefing Kate and I just covered, it said it's too complex for the public to grasp, and that's not a direct quote, but that's the idea that left me with.
Yeah, I was listening. I listened to the response.
Do you have any of these metrics? I mean, what are they?
Yeah. So okay. So here's a perfect example. So we obviously had this 5% metric that the state said don't use that, but they have not provided us any metric for when we should consider moving to a remote. We actually had Councilmember Rice, and he talked about this. The Board of Health has regulation. There was a call with the CDC earlier, I think last week, where the same question was asked: what metrics should we be utilizing for the conversion to virtual? And there was no answer description from the CDC. So we've been left at the local level to try and figure it out, essentially, just make some guesses. But parents don't like guesses. They say, well, why did you create this threshold? What was this threshold based on? we made it up because we don't have anywhere else. There's no Omicron specific data on school systems and how to operate with this. We're all figuring it out as we go. And so I think that's the best answer I can give you, is that, you know, every decision, there's the only way we can operate now is because we have no federal standard, we have no state standard, is to just assess on a case-by-case basis and the individual circumstances. Now, some of these decisions are public health influence, meaning the cases, the case rate, et cetera. But some of them are much more operationally influenced, like I think as they described on the meeting with the council just early this morning, some of them are as complex as, is this teacher actually teaching the course that they are subbing into? And what is the quality of education that's being offered? That's much more subjective in terms of, you know, what percentage of teachers are teaching out of course. I guess you could make that as a metric. What percent? I mean, so some of these, we have struggled with defining a one-size-fits-all metric that applies to all schools that we can defend with data, because that doesn't exist because no one has gone through an Omicron surge before. And so this is the complexity of where we're left. No one wants to give us feedback from the federal, state, or any other level on how they're making this decision. We've attempted to use the only metric the state provided us as a crux for a conversation, and that was immediately rejected as by the state as being inappropriate. And so we're left in this box of being like, I guess we're just going to have to figure out on a case-by-case basis, because that's just, we have no additional guidance, we have no additional data to base any particular decision on a school closure on. That's incredibly unsatisfying, even for me as a parent. And I'm very well aware of how many of these schools were Title I schools and farm schools that were announced yesterday. I mean, you know, that number is concerning for sure. But at the end of the day, we just don't have a data-driven metric that we can utilize at this point. That's like, we point to that and say, that's why we did this. It doesn't exist. And we, you know, I wish it did, because being objective would be much easier with parents. But the reality is, we just don't know what that metric would be.
Is there any evidence you're seeing that parents are cooperating by reporting in information by that Sunday deadline? I mean, are people providing the information? And of course, the challenge beyond that, as you and Kate were just discussing, there's not enough test kits to replace for the next coming week. So, I mean, is this testing protocol producing at least some results that are helping you all make these decisions?
Well, I mean,
reporting the information.
Well, I will tell you this. I mean, our community metrics and what we're seeing in MCPS are improving. I know there was a lot of critique around, you know, we should have closed. You know, there was a lot of critique from some segments of the parents that said we should have closed the first 2 weeks. Our numbers are bad because of our leaving schools open, and we're seeing a rapid decline, you know, even as schools were open, because obviously we've been able to make kits available. You know, we got through the holiday season. I'm not saying we should take credit for all. This is Omicron. It goes up and it goes down. But obviously, we've been able to support that with the testing availability, not just through schools, but many parents were accessing library-based kits, childcare-based kits. Many of them are now ordering them from the federal government. So the testing has been much more ubiquitously available over the last couple of weeks than it was during the holiday season. And so obviously, I think that we're seeing you know, we didn't give away all the tests we had yesterday to give out to the library system, which is a reflection of the fact that the community demand is slowly starting to be more manageable. And that's reflected not just in the school system, but across the community. And so I think for those reasons, we are seeing the positive benefits of people having more access to rapid tests. Again, I said this last week, them reporting the results to us is far less important than them taking the tests and acting on those results. Yes, I would love to know a complete picture of what our community COVID situation is. It would help us make better decisions. We encourage people to report. But if they're not going to report, as long as they're going to live by the results that they get from that rapid test, that's the most important thing. And so even what gets reported to us, and I don't have those numbers to tell you, even what's reported to us, even we know that that's not likely representative of the full benefit that the rapid test kits have offered.
I understand, and you've really helped me here. Let me just get one last detail on the yield. When I look at the dashboard, they're hard numbers. Active quarantines, total students quarantined, total cases reported. Where do those cases come from? How are they reported? Are they reported to a school nurse? Are they reported to the health department? reported into a state database? Where do these numbers come from?
So there's two ways that the MCPS numbers are generated. They're typically reports into the school system via the schools. They do, some students still report to schools, but they also have a centralized reporting system now where you can report directly to the administration, and then they distribute down to the schools themselves. Now, I will tell you that we're cross-referencing that with Maryland Department of Health data that they provide to us for clinically reported cases. But neither of those is obviously going to be a complete picture given rapid tests are in the community. And so we are, we have been and will continue to cross-reference the MCPS provided data through parents with what the Maryland Department of Health is receiving from clinical laboratories to corroborate or not what's being reported through the school systems. And so, I think that's sort of the back end data analysis that's occurring. But what you're seeing on the MCPS dashboard is, my understanding is, the self-reported parents reporting in typically.
Okay, so a parent would either report in the test result or a school nurse would report the knowledge of a case, and that's where the number comes from. Make sure I have that accurate.
That is my understanding, and I can certainly verify that afterwards. I don't think we're incorporating anything from because obviously we're delayed on our results at the county level because obviously PCR tests are run, they're received 24 hours later. The state reports them when we receive them. It's typically a lag of a couple of days.
Okay, thanks for the detailed answers, and my apologies to my media colleagues who had to endure a sort of sausage making line of questioning. So thanks.
Okay, thank you.
Thank you, Scott. There was one more question from Kate Ryan regarding the list of libraries making the masks available starting this Friday. Same locations and times as the test kits was the answer on the chat from MCPL Director Anita Vassallo. Reporters, I do not see any more requests from questions from you. Going once.
I have one more. I imagine you're not going to throw these 4 million masks out into all the branches right away. I'm wondering maybe even Nita can address that in terms of the capacity of how many you can get out the door at each of the branches, kind of as we start up on Friday. I know that's kind of a specific question, but.
Sure, Steve. Well, we're going to be distributing the masks beginning Friday during the same time as the test kit distribution. And we have seen a little bit of a diminishment in the lines and people eager to get the test kits. So as we are able to hand the test kits out very, very rapidly, and I think the mask distribution will go just as quickly. So I don't know how many we'll be able to do, but I think it's going to be in the tens of thousands.
On like each day or just depend?
Yes.
Okay.
No, if you look at the two links that I posted in the chat, those are the locations and the times of the test kit distributions, which happen Monday through Saturday.
Right.
So the mask distribution will just flow along with that.
Okay. No, I just want to clarify that. Thank you very much.
Steve, I think just for better context, I think what we've sent to them, so obviously Friday and Saturday are the 2 days that they'll be operating, then they'll take a break and restart on Monday. So Friday and Saturday, I think we've provided them 2 pallets, which I think is about 28,000 masks for those 2 days. That gives you about 14,000 per site that would be available. Now, I'm not presuming that they'll run through all 14,000 at each site, but that is what they have available to them at each site. And we'll reassess how many we need to supply to the libraries based on how many are given out on the first 2 days. So we did the same thing with the first test kit distribution. We kind of said we gave an amount, we gave more than we thought we could give out. We ended up giving out as much, way more than we thought we could give out. But obviously we did the same thing with masks, and we'll be able to assess based on the first couple of days how many we need to have on hand.
And we do have one final question on the chat. Proof of residency required to get a mask.
So we are asking that it be for Montgomery County residents only. I think we've been messaging that way, but obviously we have not been very scrutinous with regard to proof of residency requirements. So we do encourage, and our focus is on in our messaging for county residents only.
Thank you, Dr. Stoddard. Thank you, Director Vassallo, members of the media. Thank you very much for joining us today. Stay safe. We'll see you next time. Have a great afternoon, everyone.
Thank you all.
Thank you.